So can you share some examples of the strengths that you believe have helped your service when we're going through the pandemic?
On a personal level, it was a very challenging time due to the uncertainty of the pandemic and what effect it would have on my family and, of course, my business. However, what I tried to ensure that I did was have a really positive attitude, and I was really honest and compassionate and understanding and supportive as much as I could with families that I looked after and, of course, my colleagues. Every week, I would also do a social distance visit to see the children, just checking how they were and help if they needed any advice, help parents if they needed any information and support, because it wasn't easily accessible at that time either. I think I was far-sighted enough to understand that by keeping in touch with the children and families every week, it kept our connection really, really close. So that left little disruption for them and an easy transition back when we came back to normality as well.
So you were describing there lots of really positive things about your service, but we also know that there was lots of challenges through the pandemic. And I just wonder if you had any kind of things you would like to share about those kind of challenges when you've been supporting the children and families.
Yeah, of course. I suppose what comes to mind is during the pandemic, a lot of the community services were stopped or they were limited, and some of them still got backlogs. Among the areas I felt that were really impacted were the speech and language area and children that were on the autistic non-verbal spectrum. Other areas I looked at were ACEs, online and social factors that may impact the children, as many parents have lost their jobs or were on lower pay due to the impact of the lockdown. I was acutely aware that the trauma of isolation caused some development delays. The national trauma training provided me with all levels of essential awareness and understanding on how trauma really impacts behaviour, allowing a wee bit more insight on how to help any of the behaviours that came out of the pandemic, because we were seeing a few because a lot of the children hadn't been mixing. The other areas that I looked at as well that I thought were slightly different before the pandemic was the excellent relationship we used to have with nurseries and schools. We really worked in partnership with them. Post-pandemic, as there have been more door drops, there were fewer quality interactions with the nursery staff and the school staff to collaborate and cascade information about the children.
So can you identify any changes that you've observed in the way that the children are using the spaces within your setting, or the way that you're now having to interact with the children to support their play and learning in this post-pandemic period?
However, what I did notice was when groups started back, the younger children I noticed reacted to the increased noise more. I think because some children had been at home and hadn't been at groups, I felt that when we were in a bigger group, they needed you to be inside a lot more.
So can you share with us some of the positive work that you've been doing to support the kind of healing process for yourself and for the children and families using your service?
Of course, my colleagues and I were very fortunate enough to have a fellow childminder who had the foresight to identify an unused, overgrown area in her local allotment, which was just attached to where she was. And that area, she felt, could be developed into a really authentic outdoor learning experience for the children. So that outdoor play area was set up during the pandemic to allow the children to mix outdoors in a safe space full of really rich natural resources. It was very basic at the time. It's a much more developed space now.
Is what support you would like to see further from ourselves, the Care Inspectorate, or any of the other organisations that you kind of work closely with to help those gaps that are supporting the children and family going forward?
Okay. I think the first thing that comes to mind would be to have more early years in childcare meetings for the whole sector. Not just individuals, so like a focus group. Is at the moment I feel it's very fractured and there's no fluidity between the private and public sectors, and I feel we all have our own challenges, but I think we all have similar challenges. And I think if we got together as a group, we could all work it out, you know, whatever that may be. So if everyone worked as a team, talked about their challenges and shared good practice, I think this would benefit everyone working within the sector. I think another area that would be beneficial is an across sector what to expect from inspection. So something easy to read, like a reference guide, such as what essential paperwork we should have. So what should we have there and what really we shouldn't be having on file, so that we're not taking up all our time and paperwork and concentrating on what we're doing with the children. Another area, moving on from inspections, would be gaining more understanding would be good in how to support families, especially as a childminder. For instance, you know, how we refer families that maybe need support, you know, or children that need support. And I know that nurseries and schools have a wee bit more kind of exposure to that. So even if it came down to the local council or whoever, you know, just to give us a bit more training on how to access that type of information within the critical services and gain a bit more how to understand how we can support those challenges, then that would be fantastic.